I'm Matt Willis, Public Health Officer for Marin County with today's COVID-19 update. The outbreak at San Quentin State Prison has continued to accelerate, and I'd like to provide an update on the steps that have been taken to tackle this crisis. You might remember that on June 24th, the County Board of Supervisors requested the governor establish a state-led incident command structure to manage this outbreak, including on-site medical capacity to care for sick inmates. At that time, there were 456 cases. Today, that number has risen to a total of 1,674 cases. Last week, I joined the newly formed Incident Command working on site with state agencies dedicated to disaster response, as well as California Department of Corrections and Rehabilitation and the Department of Public Health. The outbreak is getting the attention it has needed. There have been more cases in San Quentin inmates in the past 3 weeks than in the rest of Marin County combined since the start of this pandemic, and nearly 200 cases among staff and guards, making this the largest prison outbreak in California and possibly the nation. The primary goals of the incident response were two. First, to prevent ongoing transmission, to flatten the curve at the prison, and second, to make sure ill inmates get the health care they need. Real progress is being made in both of those areas. Corrections leadership is responding to public health recommendations to move inmates who test positive out of cell blocks and into tents set up on the grounds. This basic principle of outbreak management, of separating infected people from uninfected people, has been nearly impossible in the overcrowded prison before extra tents arrived as part of the incident response. Other important public health recommendations that are now being followed include mandatory N95 mask wearing for all guards and limiting travel of staff between units to prevent spread from one building to another. These and other measures will help reduce the number of new cases and protect that 2,000 or so inmates who are not yet infected and protect the prison staff. Regarding health care, so far, about 100 inmates have been transferred out of the prison to hospitals across the Bay Area since the outbreak began. 7 have died, and some have recovered and returned to the facility. In Marin, 12 inmates are in our hospitals, especially Kaiser and Marin Health. 7 are in the ICU. All of our hospitals have stepped forward to accept these people who needed critical care. This is a sign of the compassion-driven, high standard of care and dedication to health equity in our healthcare community, and something to be proud of. It's also a relief to see that with the Incident Command, there is now more rational, region-wide distribution network that does not rely solely on Marin hospitals. To provide inmates with the on-site medical care, as of today, ill inmates at San Quentin will be moved to the newly established alternate care site, a kind of field hospital within the prison grounds. A large area that had been used for job training in the past was ideal for accommodating a large number of beds with physical distancing. This has been converted into a site for medical care. Teams of doctors and nurses have arrived from across the state to give the excellent but small San Quentin medical staff the support they need. Inmates who require oxygen and close monitoring will be cared for in this new site, and this will help protect their health and prevent transfers out to hospitals. When I toured the prison with the team, it was immediately clear to me how such explosive spread can occur. Stepping back, the stage was set for this outbreak ages ago, when the prison was designed to lock people together in large numbers in overcrowded quarters without the freedom to move. From an infectious disease standpoint, politics aside, the challenges are built in to the setting itself and the principle of mass incarceration. The inmates and the guards who have been infected are victims of the same design. Yes, meaningful steps are finally being taken to address the current outbreak at San Quentin, and all teams in corrections and public health are working together in new collaborative ways. But the lessons are deeper than that. And if there's any silver lining, it will be what we learned from this to change the way incarceration happens before the next outbreak. Thank you for using your freedom to make the right choices, and stay home if you can, cover your face when you're out, stay 6 feet apart, and stay safe.